Seymour, and I'm going to tell you about the COVID-19 outbreak based on the situation that we are currently in. These are the points that we're gonna talk about in this presentation. We're gonna start out with, what is a virus? A virus is a small, infective, and living organism that is too small to be seen by the light microscope, such as the one I have right here, but can be seen by the electron microscope, and can multiply only within the living cells of a host, and a host is a human or another animal. So now, this is the virus size in comparison to the red blood cell. And as we know, the red blood cell is super tiny. And this is the bacteria, which can possibly be seen with the light microscope. And these are all the types of the viruses. So, let's get a little visual. Oh, wait. Okay, so, let's get a little visual. So, let's say that this is our red blood cell. And this is our bacteria, and you can see the size. And these are the viruses. Two different types of viruses in comparison to the red blood cell. So, it is super tiny. In other words. Now, this is the virus structure. These are two different types of viruses. This one is composed of a protein box, a DNA or an RNA, a tail, and a bunch of proteins. However, this virus is composed of an RNA, the protein box, which is the light blue, and the yellow is a lipid envelope, which is the fat. So that's why when you wash your hands, it gets out all of that fat, and then the virus dies. And then these little sticks are the proteins. And this is the coronavirus. Okay. So, let's see how a virus infects a cell. So it starts up with the virus. And the virus has all the proteins all around it, which act like keys, entering a keyhole. So then, once it finally enters using the right key, the virus releases its RNA to the cell, which we'll say is the pink part, and then the cell will make replicas of the the RNA, and the protein boxes. And then they put it together, and new viruses appear. And that's how the virus gets reproduced, and then gets to other cells and does the same thing. And this cell, since there's so many viruses, it explodes. So, let's see now how the coronavirus enters the body. The coronavirus only enters the body in 3 places: the eyes, the nose, and the mouth. So the coronavirus enters, let's say, your nose, and then goes down all the way and can affect your lungs. So, this is your immune system fighting the virus. Your immune system is like the warriors that defend your body against any virus. So when they are the white blood cells. So if you have more white blood cells, your body will be better defended to defeat any virus it faces. But if your body is weaker, with a weaker immune system, and it only has few white blood cells, then your body will, you will get majorly affected. So now this is the white blood cell fighting the virus, which is the purple. So what it's trying to do with its long tentacle-like arms, it's trying to catch the virus and produce some acids so the virus can explode and disappear. Now this is the coronavirus structure. So the red over here is the protein box. This is the RNA, And all of these are the proteins. Now, this is the coronavirus family. So we have to remember that the virus is SARS-CoV-2 virus. And COVID-19 is what's produced by SARS-CoV-2. So now, this is SARS-CoV-2's family. This is the family, the subfamily, the genera, which is the alpha, beta, gamma, and delta coronavirus, the lineage, which brings us to SARS-CoV and SARS-CoV-2. Now, this is another slide, which the only difference between this slide and the previous slide is that this one shows all of the viruses, not only the ones for humans, but the ones for other animals also. As you can see, some of them says that. Now, these are the coronavirus reservoirs. A reservoir is an animal that can transport the virus, but it won't get affected by the virus. So, in this case, it is the bats. One specific type, which is called the horseshoe bat, which is right here. So now, the bats gave it to the cybit cats first in 2003, which produced a virus called SARS-CoV, which is severe acute respiratory syndrome. And then it gave it to the camels in the Middle East because people there ride camels as horses. So this caused the Middle East respiratory syndrome. And now, what we are experiencing right now, we think has been transported by the pangolins, and now creates SARS-CoV-2 because it is very similar to SARS-CoV. Now, this is our respiratory system. Starts with the nasal cavity, down to your pharynx, your larynx, your trachea, your bronchi, your bronchioles, and then your lungs, and at the very tip, your alveoli. Now, let's take a closer look at your alveoli. So, these are your alveoli. They're sort of like balloons because they hold air inside them. So, this is your bronchioles, which transport the air into your alveoli. So, what happens is that it gives the air to in this case, the blood vines that have no oxygen, and it gives it oxygen so that it can transport it to other cells that may be in need of oxygen. So let's make a little visual of this. So let's say that this is your red blood vessel, your blood vessel, okay? So when it has air, it gives it to the other cells of your body, and then it has no air. So then it goes back to the alveoli, and it receives more air, and it goes back to the cell and on and on and on. Forever. Until the COVID-19 came along. So this is an x-ray of your regular lungs. Now this is COVID-19 affected lungs. So what it does is it creates some blotches that stops the transportation of the alveoli, and now other cells can't receive that oxygen. So this may cause the symptoms: cough, runny nose, fever, shortness of breath, poor sense of smell and taste, red eyes, dry eye symptoms, and fatigue. So now, in very severe cases, such as this man, you have to receive mechanical ventilation. Mechanical ventilation is when this machine gives you oxygen to your trachea, and it does this by a tube that goes all the way down to your trachea, and it gives it the oxygen through the bronchioles and the bronchioles, and to the alveoli and on into your lungs. So this man is giving the oxygen, and then it goes all the way, like I said. So this is the disease severity. So here we have 100 people. Out of this 100, 80 will receive mild symptoms. And out of these 20, they will probably need mechanical ventilation. And 17 of these will survive, and unfortunately, 3 will die. So these are the risk factors for the severe disease. An advanced age, diabetes, lung disease, heart disease, and a weak immune system, because then you have less warriors. Now, this is how to diagnose COVID-19. You have the symptoms, because if you have somebody that walks into your hospital and says, my back aches, do I have COVID-19? You're most likely gonna say no, because those aren't symptoms. Like, most likely you don't. You could probably have it, but most likely no. And then exposure to a COVID-19 affected person. So let's say I still go to school, and my best friend at school has COVID-19, and I'm hanging her with every day. So then, if I show the symptoms, or even if I don't, I may have COVID-19 if I go to the hospital. Coming from a place with a high number of COVID-19 affected people. So as we know, the horseshoe bat came from China. So then if I just show the symptoms and I came back from China, so I go like, just came back from Hong Kong or something, then I probably will have COVID-19. Then this is a PCR, which is a test on your nasal cavity. So it can be done through your mouth or through your nose, which detects the virus's RNA to see if the virus is still there. And if you present negative, then they might take you to test the IgG antibodies, which is a blood test which shows if you had a prior infection. This is because your blood already has all the warriors to defeat that virus. So just to make it a little easier, the PCR, this has a cotton tip that goes into your nose and just sees the current infection, and then the IgG antibody just sees the weapons that your body may have by the white blood cell. So then, as you can see, this is the white blood cell. So it has two ways of defeating the virus. One way of which I already mentioned, using the tentacles, and another way is sending out these weapons to the viruses that are farther away to try to defeat it. And now these weapons is what the test IgG detects. Now, how to treat COVID-19. Patient isolation. So this red person in the middle should be you. You don't want to be like any of these yellow people. Adequate nutrition, high in protein and vitamin C. This helps your immune system to be stronger, so then you can defeat the virus. Drink a lot of fluids. This is because if you have the virus, one of the symptoms is fever. When you have fever, you sweat, and then when you sweat, you're giving off a lot of fluids. So then you should drink some so your body doesn't become dehydrated. Antibiotics that are prescribed by your doctor, but as for now, they aren't very effective. Plasma from recovered patients. This is because when you have like the blood with all the warriors already, with the weapons, and you give it to a person that currently has it, now the body will know the weapons and can fight the virus easily. So that's what this person is getting. Medications that block the keyhole from the host. So what happens is that if you block the keyhole, the virus can't get in, but you have to block it partially because the keyhole also gets all the other proteins that your body needs. But it's not available yet, unfortunately. And mechanical ventilation, of course, for severe diseases. Now, this is blocking your keyhole. So these are your keyholes, and this is the human cell, and this is the virus trying to find the right key. Now, if we do this, then you block the keyhole partially because you see there's some room to still get the proteins, and then the virus won't ever find the right key and will eventually die off. Now, how to prevent COVID-19? Social distancing, which means 6 feet apart at the least, because the virus can only travel 6 feet when you sneeze. Groups of 10 and less, so that less people can get the coronavirus, because we don't want a lot. remote learning and remote work, so that the learning and the work can continue, but remotely. Stay at home. So stay at home so less people get it. And avoid handshaking, but you can elbow shake, as these ladies are doing in this picture, or this GIF. Wash your hands for 20 seconds at the least. 20 seconds is enough time for the virus on your hands to get rid of itself. As we said, the fat of the body, you have to delete it. Use hand sanitizers when you don't have access to soap and water, but soap and water would always be your best choice. Don't touch your face at any moment, because remember, the eyes, nose, and mouth are the places where the body can enter. The virus can enter. Wear a mask and gloves. So, mask and gloves can protect the virus from getting to your nose, mouth, and can protect it from getting to your eyes. And as some doctors that are still working, this is my dad. Sometimes he goes to the hospital, and he's using a face shield to block the virus from getting into his eyes, because sometimes he sees a lot of patients per day. And a vaccine that's not available yet, but may be available in several months. So, you may have heard people say, we have to fly in the curve, but you might ask yourself, what does this mean? It's just an ordinary curve. So this is a graph of the number of cases and the time since the first case. Not only do we want to flatten the curve so that the country isn't infected, but also, let's say you have your hospital that can hold 100 people. Now, that's over here. But if you go over 100 people and it gets to more like 200, then you can't serve all of them, so they have to go back to their home, and then they can possibly be majorly infected and can infect it to more people, and that'll be terrible. And if you see in this graphic, if you keep the curve low, then everything will be way better. And obviously we're going for 0 cases, but that's not possible right now. This is the outbreak in the USA or in Florida. So in Florida, there is around 23,000 cases. In the US, and let's say 600 deaths. And in the USA, there's around 665,000 cases, let's say, and 33,000 deaths. And in conclusion, a virus is a microscopic living organism. COVID-19 is a disease provoked by SARS-CoV-2 virus. The disease may affect the respiratory system, including the lungs. There's no treatment for COVID-19 yet. You should try to stop the coronavirus pandemic by practicing social distancing, washing your hands, and by avoid touching your face. And flatten the curve, and a vaccine may be available in several months. And that is my presentation on the COVID-19 outbreak. Thank you. Stay safe.